let me move on to my experience as a resident. My residency was traumatic. I don't know. My first 2 years, I just feel like they were a blur. That I wish there was a different way. But it's funny because residency does not have to be like that. It does not have to be so difficult, so horrible, so nasty. It does not have to. People could be more nicer. You could be more pleasant. We are on the same team, for example. Okay, so just back to my personal story. I had a baby in my 4th year of medical school, nice and well. Okay, and then I had a baby in my 1st year of residency as an intern. I came in with a very pregnant belly, and for the first 3 months I tried to do everything I could possibly, but it's hard when you have a pregnant brain as well, because pregnancy does a number on the brain. It decreases your focus, your concentration, and when your brain decides it's tired and it needs a nap, yeah, it's just gonna take the nap. It's gonna take you out. So I struggled my 1st year of residency. I don't know how I did it. I don't know how I did it. By the grace of God, here I am. After my 1st year of residency, I was in danger of being cut out from my residency because I was dealing with a newborn baby, breastfeeding every 3 hours at night, waking up to breastfeed a child. And I had a toddler. Okay, so I had 2 children in car seats. One in a baby car seat, the other I put in a stroller. When I got off from my residency duties, I was on home duty for the rest of the night until morning. I had very little time to study. Very little time. In fact, going to residency was like a reprieve from motherhood duties at home. And I didn't have help at home. So come the end of the year, I was just getting bad reviews here and there. And the other thing too is I felt like nobody wanted to help me. No one told me what you were doing wrong. Nobody said this is what's expected of you. This is what, it's just like you were just thrown in with the wolves. Whereas medical school was fun, happy, no real patient responsibilities. You contributed to the team, but you are not responsible for that patient's outcome in the hospital. You contributed your ideas and your notebook and stuff like that. Now, residency was just like, here you go, but anyway, as I said, I feel like you may think that other people had the same residency as you did, but their experiences were different. Their experiences were different from you. They were not female, they were not black, they were not an immigrant, they did not have 2 babies like I did. Yeah, I brought that upon myself, having 2 babies, but I'm just telling you that this thing was traumatic. And coming out of there, the last thing I want to do is even to talk about it. It's like, let's file that away. File that away, leave it there. We're not gonna touch it again. We're just happy we graduated, we have a degree, we spent 4 years, the required amount of time. Yay, I'm attending now. But I'm just bringing it up because I want other people, if they are having difficulties, trouble, feel free to reach out and know that you're not alone. And in the words of what Ketanji Jackson said, that somebody told her when they saw her walking through Harvard, they said, persevere, persevere. So what I will tell you, you in residency, persevere. Continue to persevere. It will be worth it in the end for you.